Hi, and welcome to the show. Subscribe at kevinmd.com/podcast and get CME for this episode by clicking on the CME link in the show notes. Today, we welcome Sonali Mantoo. She is a critical care physician. Today's KevinMD article is A Critical Care Physician Battles Long COVID with Hope and Grit. Sonali, welcome to the show.
Thank you, Kevin.
We'll talk about your article in a little bit. First off, briefly share your story and journey.
So I am an ICU physician. I was born and brought up in India. I moved to the United States to do my residency in internal medicine, followed by a fellowship in critical care and then simulation education. For most of my time in the United States, I've spent it in New York City, briefly in St. Louis and Connecticut. And, the pandemic frontlines was an exciting experience. I actually served in Mumbai with MSF for Doctors Without Borders because I was on a sabbatical in India during that time. And then for the second half of the pandemic, I was in New York City working in my job on the front lines when I got COVID, probably 2.5 years after the pandemic first started. And this is after 4 shots of the vaccine. So I had 2 of Covishield in India and 2 of the Pfizer in New York, and still managed to get Omicron and then got stuck with long COVID.
All right. So you talk more about that story in your KevinMD article, A Critical Care Physician Battles Long COVID with Hope and Grit. So tell us about your experience with COVID. When you initially got infected, how did it feel? And what did it feel like as it transitioned into long COVID?
I honestly just had mild COVID, which felt very much like the flu.
Mhm.
I was at home with mostly normal vital signs, just a low-grade fever, very fatigued though. And then, one was isolated. But living in a place like New York City, everything comes to your doorstep. I was so tired that I would even get my morning coffee. That's how bad it was. And then I had this hacking cough, so I wouldn't even get on the phone, didn't feel like even watching TV. So I was sleeping most of the day. Never had the need to go into the hospital. I just had an urgent care visit. I was 41 at the time. I'm 43 now and fairly fit, doing yoga and dance and active doctor in an academic institution. So I was confident that I would get over it pretty quickly until I couldn't even stand to shower. I had to sit down to wear my clothes and I was breathless trying to make a cup of tea. And I started freaking out like, did I come down with, myocarditis or pericarditis? Actually, I probably wasn't as worried because of the thick brain fog, but my colleagues were because I wasn't really able to come into work. And when I did, I would I would see a patient and then lie down and then see a patient and lie down. Somehow sitting didn't give me the same feeling of being rested. And then when there was a code blue, I would sit down to run the code. And then I was like, this is not sustainable. So then I went for an extensive workup and maybe a couple of weeks in was diagnosed with long COVID.
So tell me about that workup. You weren't getting better. You said that you wouldn't feel rested unless you lie down. You're running code sitting down. So tell me what happened next. Like, what kind of doctor did you go to? What kind of workup did you undergo?
So lucky for me, obviously I have access to the best resources. I was immediately plugged in with, a cardiologist, a pulmonologist, heads of departments, and I guess the initial suspicion was I had some cardiac issue because I was actively struggling to maintain some level of endurance. Like I couldn't even walk 10 or 20 feet without being short of breath and fatigued. And for someone as fit as me, that was an alarming sight to even watch. So I took my hiking pole as a walking stick.
Mhm.
And so they did the usual. They did an echo. They did a CT angio to rule out, pulmonary embolus or a DVT
Mhm.
study to rule out an acute clot, and then just basic lab panel, and everything, absolutely everything, was normal except for a slightly high D dimer, which of course isn't very, indicative of anything except that I had an acute infection recently. So, after a lot of discussions, and there had been a recent study called the Michelle trial, which had suggested 10 milligrams of rivaroxaban, an anticoagulant, for so called young athletic individuals
Mhm.
who was stuck with this debilitating form of long COVID. And we all thought long COVID was associated with people who were elderly, hospitalized, on the ventilator, on life support. And this was a relatively new phenomenon to have somebody who was functional, independent at baseline. I wasn't sick enough to be admitted to the hospital, but I wasn't well enough to really, function on my own. So they started the rivaroxaban, and I did make an incremental improvement with a lot of tweaks in my lifestyle. So by that, I mean, everything came to my house. I used to live alone, and
Mm-hmm.
I would order everything. I stopped socializing. I very carefully compensated for it. Like I would go to work, but then I wouldn't take the stairs ever. For rapid response, my colleagues knew that somebody had to show up before me. I wouldn't do any procedures. I would just sit down and instruct the fellows, or so it was, fair amount of compensation to look normal. And that lasted for 6 months before I went on disability. So
At what point did you realize that you couldn't work with your condition?
So 6 months into this initial phase, I did make an improvement and even managed to take a flight and go to California for a holiday, which was probably not advisable at the time because it wore me down and I was
Mm-hmm.
exposed to COVID there, unfortunately, again. And so when I came back to New York, which I managed to once again, the re-exposure completely set me back to square one. So I contracted Omicron in January. And then by August, I felt exactly like how I felt in January.
Mm.
So then the repeat workup was done. Echo, DVT study, pulmonary embolus rule out, same exact results. But this time, I was seen by the long COVID research group at Mount Sinai. And that to me was a huge blessing because it's run by a group of physiotherapists who have made this their specialty. And when I went in to see them when I could, because most of the time it was all telehealth and virtual visits, I was tested positive for POTS syndrome, the
Mm-hmm.
postural orthostatic tachycardia. And that was the first time I actually had any tangible evidence of an objective abnormality. So my heart rate just spiked to 140 on standing. So clearly I wasn't able to stand, and that explained why I had to keep lying down between patients. And then I was introduced to terms like dysautonomia and ME/CFS, or myalgic encephalomyelitis, and chronic fatigue syndrome that happens in post-viral cases. And it can last for years, but they do get better. And it's very debilitating. And something called PEM, so post-exertional malaise, which is extremely different from fatigue. Like one just crashes after a period of overexertion. So my whole trip to California, being exposed to COVID again, just dialed it back to square one. And I still went to work, even though my doctor told me you have to file for disability. I didn't I didn't believe her. And then when I was at work on an ICU shift, I was breathless and I tried to use oxygen and it did nothing for me. I was surprised because my saturations were 99% and I was breathless and I was like, this can't be in my head
Mm-hmm.
because I physically can't move. It was like a resistance to movement. So that was the end of that. Yeah, that was September 2022. Yeah, and I haven't been back to work since.
So tell me about the time period between September 2022 and now. Have you made any noticeable improvement? Are you getting worse? Has your improvement plateaued? How are you now compared to that time?
Definitely better. And the misleading part of this so-called invisible disease is one tends to look and sound normal. So over a video call, I'm often told how great I look or how much of a discrepancy there is between my symptoms and the way I present. But one has to be with me during a normal day to see how long I take to perform ADLs or activities of daily living, like taking a shower, brushing my teeth. The way the recovery was explained to me is that it's a sinusoidal curve. So it comes and goes, very much like an autoimmune relapsing remitting condition.
Mm-hmm.
There will be flare ups, and those flare ups can be brought on by infection, a period, overexertion, and then you'll be set back. So I would say definite progress, no doubt about it. just not able to sustain that progress long enough to be able to either live by myself or go to work. And to me, those are the two hallmarks of complete recovery.
Are you still seeing a long COVID clinic?
Yes, absolutely. I have a slew of doctors, but the main providers who really have seen me through the whole spectrum of this long COVID is a long COVID clinician. He heads the long COVID clinic in New York City. And then I have a rehabilitation physician who also sees a lot of long COVID. Yeah.
And
Mhm.
as we're speaking today in the beginning of April 2024, are there any proven treatments that help with long COVID?
$1 million question. Pacing, that's not really, if you're looking for pharmacological treatment, no. The answer is no. None. Everything is experimental, and I've been through so many of these experimental treatments, one after the other. I try to do one thing at a time so I can tell whether it's making a difference or not. We have learned a lot from SARS and MERS and those who were left with debilitating ME/CFS, POTS, post-viral sequelae syndrome, or from other viruses like Lyme disease or anything else, how to manage ME/CFS and live with it. But treatment-wise, to my knowledge, rest, pacing, physiotherapy, and really tweaking your lifestyle to just adapt to this new baseline, if you will. Another thing long COVID has done is it has brought up any latent, dormant conditions that you might be susceptible to. So if you were, you had a predisposition to gut issues or hypertension or rheumatoid arthritis or some other genetic issues, then chances are you probably have to rule out the presence of those,
Mhm.
get tested for them. And that's what I did because my initial symptoms were terrible joint pains. And then I have a, familial history of rheumatoid arthritis. So I had to go through all that to make sure it's nothing but long COVID. And even just being in my 40s, I had to make sure it wasn't coronary artery disease or onset of something else.
Now, when you talk to your clinicians today, what kind of prognosis are they giving you? What can you expect going forward?
Well, I'm told I have a really good chance of making a full recovery based on the progress I have made in the last 24 months of long COVID with a very fit baseline and sustained motivation and a hell of a lot of support from my loved ones. And of course, my access to resources, which I know I'm a very privileged long hauler. I The first time I saw a long COVID specialist, he told me, "You could very well live like this for the rest of your life."
Mm.
And I was gasping for air at the time, holding my walking stick. And I told him, that's not a very nice thing to say to somebody who's, struggling. And he's like, well, I just need you to be, be prepared for the worst.
Mhm.
The thing is, I don't think anyone has enough data to say either way. And I've learned a lot from my peers. So long COVID patient experts are just as useful, if not more, than the clinicians that I'm seeing, because they are speaking from experience. And my biggest source of hope and inspiration is a 25-year-old male long COVID survivor who I met a few months ago, and he's running half a marathon now. He contracted long COVID back in 2020 when there wasn't even a term for it,
Mhm.
and went through the whole rigmarole of going through tests and experimental treatments. And he's studying artificial intelligence in Belgium, but he sounded more like a doctor than anyone else I've met. And just seeing his progress, I get it. He's 20 years younger than me, but I don't know. I just felt that there are people who make that kind of progress. And my hope is that I will too.
Now, by sharing your story and perhaps clearing up any misconceptions about long COVID, what are some of the messages that you want viewers to come away with after hearing your story?
Long COVID is real, very real. Please believe people who tell you they're not able to articulate exactly how they feel, or they feel under the weather and they can't put a word or term or adequately explain their symptoms, because it's, I don't want to compare it to mental health, but just like how mental health faces this sort of disbelief because you can't really see a shoulder fracture sling to garner the same kind of empathy and compassion. Long COVID is very similar unless you spend a whole day with somebody who's going through long COVID. I'm often asked this question by my own loved ones who are there for me. What do you do all day, Sonali? And I'm like, you know, my days filled with being an ICU physician and still running a household and going out and having a social life and keeping in touch with all my friends and family, maintaining good relationships and traveling. My day is still as busy. It's just that everything is done at a much slower pace, very deliberately, very intentionally, very mindfully. And this is coming from someone who has relentlessly pursued wellness practices, just given my life experience and my profession. And therefore, I'm able to keep my head above water and even speak to you on this podcast. If I'm speaking to you now, continuously able to engage over a Zoom call, it means I have used oxygen, rested, saved up my spoons of energy in order to make this conversation happen. So please don't underestimate, like, to whoever's watching this, the amount of work that goes into saving up before we make an appearance in any social setting.
We're talking to Sonali Mantoo. She's a critical care physician. Today's KevinMD article is A Critical Care Physician Battles Long COVID with Hope and Grit. Sonali will end with your take home messages to the KevinMD audience.
Just be kind to each other. We're all fighting battles that we know nothing about, especially someone sitting right in front of you. And so keeping an open mind and being flexible and just, yeah, being good to each other goes a long way. And thank you for doing what you do, because before I made the decision to even move to the United States, I was introduced to your blog and I've been following it for very many years. And it has given me a lot of hope, direction, guidance, and validation from the time that I was trying to become a resident and today when I'm trying to share my story as a patient. So thank you.
Well, thank you for sharing your story and reading and perspective and insights. And thanks again for coming on the show.